before, 4 months post-op.
Our lovely patient who is 38 years old and has come back in to see us 4 months after surgery. She did require a umbilicus reconstruction due to the extensive muscle rectus diastasis as well as umbilical hernia that she had. But she's very kindly agreed to share with us an additional piece of information that we didn't know before.
I've had 3 children, and like most women, I would pee when I sneezed. And I no longer do that, which is very exciting to me.
That's fantastic. And you also said the repair of your abdominal muscles helped with your bar.
Balance, yes.
Yeah.
I like to do the bar workouts, and I go running a lot, and my balance is night and day. I can stand on one foot.
It's fantastic. And how about your lower back?
I no longer have any lower back discomfort.
That's fantastic.
Ever.
And you were saying that you were recently at a dinner party and someone was asking, wow, you look great. What did you have done? And you said?
I explained to them I had my muscles repaired and some extra skin taken off and a large hernia repaired. And we were talking a little bit more, and that same girlfriend went, well, at least you didn't do anything vain like get a tummy tuck. And I had explained to her what a tummy tuck was.
Well, I appreciate you sharing your story, and I'm so very happy for you.
Thank you.
You're so welcome.